Doctor's therapist of Reddit. Do you have any no, that's not normal stories? If so, what abnormal habit oddity did the patient have thinking it was normal? Guy in his 20s came in complaining of belly button problem. I examined him. He had an irritated scab inside the belly button caused by aggressive limb picking. But dude was sweaty and had a slight tremor. Looked like crap. When I asked how he was feeling overall, he said, "Oh, okay, I guess. Just a little tired. Drank a little more this week than usual. Probably overdid it." I had to pry for details and turns out he drank a gallon of gin over the last 3 days and stopped drinking alcohol when he started vomiting large amounts of blood and pooping a mixture of bright red blood and dark sticky stuff. Melina digested blood. Full stop. He was totally unaware of the fact that he was going through alcohol withdrawal. Sweating, shaking, because he hadn't stopped drinking long enough in recent memory to experience symptoms. I sent him straight to the emergency room, where they found a tear in his esophagus that required immediate intervention, and he was admitted for inpatient alcohol detox. I read his hospital note. He still insisted that the ED doc examine his belly button. I love the note at the end. "I don't care about my life. Just save my belly button." His belly button did, after all, potentially save his life by being scabby. Woman came to the hospital because she was feeling tired and casually mentioned her persistent vaginal bleeding she'd been dealing with for 2 months. She said it wasn't ever a large amount, so she didn't think twice about it. Labs were done and her hemoglobin was 3.9. For context, that's low. Like, you should be dying low. But she looked perfectly fine. 50-ish-year-old man who came in for chronic issue follow-up. He brought his wife with him this time around. At the end of the visit, she says, "Hey, tell the doc about that thing you can do." He turns to me proudly and tells me that he can whistle from his penis. If he really pushed, he could blow gas from it. His wife insisted it wasn't normal, but he was certain most guys could. Turns out, he had a connection between his bowel and his bladder. Mom brings her kid in because the babysitter was concerned about these spells the child would have. Apparently, the child would have episodes where he would just blankly stare at them and not acknowledge whatever it is they were telling him, or whatever he was doing. The parents just thought he was being a butthole and not listening to them, or being absent-minded. Kid turned out to be having absence seizures. A younger gal who had come in for generalized abdominal pain that she experienced on and off for years, but just always wrote off to either menstrual cramps or bad food or life. We had asked her if her bowel movements were regular, and she said yes. At some point, someone was sharp enough to ask her how often she had bowel movements, to which she said about once every 2-3 weeks. She had been suffering from pretty severe constipation, but just thought it was normal to have BMs once to twice a month. I'm sure I have more, but I think I wrote enough for now. Not a doctor, but I had an experience like this with someone I slept with. We had just finished and were cuddling when he remarked that he was happy he felt like he was in his body. I looked at him funny and asked him what he meant, and he said, "You know that funny feeling you get after sex where you feel like you're not in your body? You're like looking at yourself from the opposite side of the room? Well, right now I don't feel like that. I feel happy instead." I tried my best to not look horrified and I asked him if it was always like that for him. He explained to me that it only started happening after something awful happened to him 2 years ago. I had to do my best to gently explain that no, I do not get that funny feeling and most people don't. I also had to explain, to the best of non-professional capacity, what disassociation was. That's tough, but sounds like you must have done something right that your fling made him feel safe instead of dissociate. It's amazing how much our brains do to protect us from bad feelings. I was the patient, but when I went in for a routine physical, the doctor poked my extended belly and asked how long it had been like that. I laughed and said, "What? My beer belly? Oh, since I was 21 probably." Turned out that, no, the beer belly was a cyst that had grown really large, and that was why my friends kept saying I looked pregnant. I thought I just had really crappy friends. Had to have emergency surgery, and for a week or so they did not know if it was a cyst or ovarian cancer. It was a pretty big scare. Believe it or not, this also happened to me. I found it because I became pregnant and they saw it in the ultrasound. Also had to have an emergency surgery and I lost 32 pounds that day. I always just thought I gained weight weird or something. The lady with type B COPD who had long-term cigarette user symptoms. She spontaneously got COPD, having never smoked in her entire life. A pimple on her breast that was actually a 4-inch wide, bleeding and necrotic breast tumor protruding through her skin. Oh, that's sort of like me. I thought I had a pimple on my back, until it shot out what I could only describe as moldy old cheese mixed with cream of chicken and blood. Wasn't necrotic as far as I know, just an abscess. The smell is indescribable. I'm sure you I assume, a medical professional know what I mean. I was the patient. I had no idea that it wasn't normal to uncontrollably sob for 2 weeks out of every month, have breasts so sore I couldn't go downstairs, jiggle, and then have it all stop the day you start your period. It took me getting a female roommate at 30 for me to realize that wasn't typical. I asked my OB-GYN after charting my symptoms for 6 months. PMDD, a depressive disorder that is tied to your menstruation. A change in birth control pills fixed it right up. He also looked at me like I was crazy for thinking that was normal for 16 years. I asked my mom after my diagnosis. Oh yeah, remember in high school, your friends would come over and ask if you were crazy that day or not? No mom, they didn't ask me that. Thanks for letting me know. I have PMDD too. I didn't realize how crazy I was until my husband forced me to go to the doctors at nearly 30 years old. Been on Prozac ever since and feeling a lot better. I feel like my story belongs here even though I'm the patient since the exact scenario happened to me. A few years back my mental health totally took a skydive. As a result I dropped out of school and had to start a recovery program. The first thing I had to do was talk to a psychologist. During these conversations with the psychologist, she'd focus on different parts of my life. So one day she'd ask about relationships and the next, childhood memories and so on. After a few conversations she focused on my social life. I then told her that it's pretty much non-existent, and it always has been. She then stated that I must have suffered from loneliness a lot then. I just told her that I've never actually felt lonely at any point in my life. After all, it's pretty hard to feel lonely with the two voices in your head always keeping conversation. But surely she knew that, right? Well, as it turns out, no. Apparently everybody else only have their own voice in their head. My entire life has been a lie. Turns out I'm schizophrenic. Who TF knew I? Obligatory I'm the patient. I thought for years that I was just continually getting more and more out of shape. Despite my best efforts, nothing helped. I would just hit this wall and couldn't keep going. Eventually I couldn't walk from my driveway to my house without needing a break to breathe. Turns out shortness of breath isn't just something to wave away, it's also something I wish doctors had taken seriously. In the span of 2 weeks, I went from seeing a local clinic PA to being admitted to the ICU. My doctor told my husband he had no idea how I was still alive, nevertheless functioning. This was me with my heart problems. I literally thought I was just lazy and out of shape but never improved despite me trying to work out more. Turns out I had literally been in heart failure my entire life. It eventually quickly tanked to the point I needed a transplant. Now I feel like a freaking superhuman because I can exercise without feeling like I'm dying. Was on urology rotation in medical school when a 20-something-year-old male presented with the complaint that one of his nuts was too small and he wanted them to be equal because it was embarrassing. One testicle was normal, the too small one, while the other was the size of a grapefruit. Unfortunately the cancer had metastasized. Not sure how he did long term as I rotated off the service after he had surgery. As a patient, I went in for a standard sleep study because I was always exhausted. Doctor asked me afterwards if I would consider signing a release for him to write a paper on me. Apparently I moved my legs over 9,000 in the course of the night. Apparently it was RLS. I wasn't realizing I had. My wife never even told me I did it and I had no idea. She casually agreed after I told her what the doc said. I barely met the recs for moderate sleep apnea, where they will RX a machine. God, I love that thing. I sleep so much better with it. Wifey on the other hand, uses hers and sleeps with her mouth open. So annoying to listen to the air hiss out all night. I had a root canal needed in a molar. I went in so he could prep it for the next step. but 2 hours in and he had to call it for the day. So by the fourth 2-hour visit, when it was finally done, I was sick of seeing my dentist. Almost a year later I'm back at the dentist, and he turns to his assistant and says this is the one with that root canal. I'm a legend, apparently. Not a doctor, but when I was maybe 14 or 13 I remember describing to my primary how during my periods I would pass out from the pain, couldn't move or I would get sick, and told her a story about how I went on a trip to Italy and sometime in the middle of the flight became wildly sick to the point of terrifying the poor flight attendants. I'm so sorry flight attendants. By filling 4 puke bags, crawling to the back of the Death has terrible customer service, and then passed out when we exited the plane. But periods are supposed to be painful, right? The doctor was like, honey, you're supposed to experience some discomfort, not be incapacitated. Anyway, she put me on birth control and I've never been happier. I'm more disturbed they wouldn't let a 13-year-old girl clearly suffering from some kind of debilitating illness go into first class to use their restroom. That's absolutely cruel. Obligatory. I'm not a doctor. Blew it. I have celiac disease and am in the process of getting a Hashimoto's hypothyroidism diagnosis. I was the abnormal patient when I was a little kid, because not only did I get monthly bladder infections, apparently I had to use a catheter for a while, but I don't remember that at all. My doctor was confused why I always had extreme gas, joint pain, and weekly headaches at the ripe old age of 6. Turns out it was just me slowly dying because I ate a lot of wheat bread with celiac disease. Celiac is a nightmare. I was 17 when I was diagnosed. Symptoms can come on super fast too. I think I dropped something like 7-10 pounds, which on my frame was pretty significant, and that's what got me into the doctor's office first. This happened to me. I woke up with a period so heavy the bed was soaked. Stood up and it just poured out of me. Clots the size of my palm. Overwhelmed, I did what any woman would do, if they could, and phoned my mum to come over and comfort me and help me clean up the mess. At this point I was still thinking, this is a strangely heavy period, and I was more worried about how my My parents called an ambulance that arrived to the house first and rushed me to hospital. Not period. Massive internal hemorrhage in the womb. That's terrifying. 95-year-old veteran 5 years in remission from kidney cancer. Came in with 72-year-old wife for routine follow-up. She wants to know if it's safe to have sex every day because she is worried about his health. Yup, 95-yo. Fricks every day. No Viagra. We just said, congratulations, yes. Sex every day is very good for your reproductive tract, penis or vagina. It keeps blood flow going and helps you maintain function of your bits for as long as possible. Use it or lose it, essentially. And it doesn't have to be with someone else, either. I'm a therapist and a couple came in and were fighting because they didn't want to have sex. I told them they didn't have to. They were fairly confused and thought I was lying to them. Now they have 3 kids. I was the patient, but mine was kind of backwards of the whole thing. I feel like it's close enough to fit. When I lie down on my back, my feet turn out lay completely flat. They've always done this. My bones in my legs are twisted and that's the most comfortable position for them. This was the day after I broke my pelvis and I was going to the doctors to see what the damage was. The doctor didn't know about my feet, so he had this terrified look on his face when he saw me and headed back out. My mom had to talk to him and tell him no, that was normal because he assumed I broke both hips. I was the patient. When I was growing up, I had constant stomach aches. Every time I ate, I'd get sick. I went to the doctor multiple times for it, but they could never figure out what was wrong. Eventually, I started to think that everyone lives with pain like that, and I was just being a wimp and couldn't deal with it. I barely ate, such that I was super underweight. I was miserable all the time. I was constantly stressed and depressed because of this problem. Fast forward to grad school. My first year is in China. I'm there for a few months and then, Over time, my symptoms disappear. I don't have stomach aches anymore. I gain about 40 pounds seemingly overnight. Now I'm at a healthy, doctor-approved weight. My depressive symptoms disappear almost entirely. But how could that happen? What could have caused such a change? Turns out, I'm lactose intolerant. I grew up in the Midwest where pretty much everything has dairy in it and I'd been eating it constantly for so long. It took months for my system to reset. Being in China where dairy isn't such a staple made all the difference. I felt like such an idiot when I realized that was what was making me ill. On the plus side, I feel better, look better, and am a much happier person now. TLDR. Constant nausea and stomach aches are not normal. I myself have constant nausea and stomach aches. Thank you for posting this. I'm going to ask my doctor to do a food intolerance test. Didn't even think about that. When I was in medical school, I had a mother come in because her son was having behavioral issues at school. He was skipping, depressed. Didn't take long to find out he had encopresis. He basically pooped himself without knowing it, which would be hard at any age, but especially in school. Deep dive, he played Xbox every waking moment with no bathroom breaks, stretched things out until he lost sensation, and stuff could squeeze out. That's horrible. When I finally got on medication for my anxiety, I found out getting irrationally angry and frustrated almost to the point of crying and screaming at people for touching things certain ways, putting the dishes away wrong, chewing, moving my stuff a few inches or talking to me when I didn't feel like talking was, in fact, not normal. Thank God for Prozac. Same. Prozac is the best thing that has ever happened to me. It's the first medication that I've taken that has worked really well for me. When I started taking it and it really started to take effect at about week 5, I came in the bedroom in tears to tell my husband that I felt normal. I had what I thought was a mild staph skin infection that just wouldn't go away. I ended up having to see an infectious diseases specialist and was on high-dose antibiotics for 18 months. 2 pills 4 times a day. RIP your intestinal biome. Didn't realize until college when having a discussion in a psychology class that most people have a mind's eye and can see things visually in their mind. I have never had a daydream and thought I just didn't have an imagination. Turns out I have aphantasia. When I was young, I had an overbite that needed to be corrected by my orthodontist. He gave me the option to use headgear at night for a few years, or use what they call a Herbst device. After deliberating with the family, we decided I would go with the Herbst device, as it would only take 1 year to correct the overbite. So, I lived with this thing in my mouth for 1 year, and it sucked. Every facet of it sucked. My bottom jaw was covered with a plastic plate, and rods pushed my jaw forward. Finally, the day came when they were to remove the device. I think anyone who's had braces can relate to the feeling of impending oral freedom and the excitement therein. They removed the plate and the rods, but left the palate expander in, because it had not yet reached the development they were looking for. This is a good time to mention that the rods were attached to my palate expander with screws, and the bottom half of the rods were attached with screws to my bottom molars. After a couple of weeks, I started to lose weight and hardly talk. I didn't want to talk, because my mouth hurt too badly. I thought it was normal after having a procedure like this. They chiseled cement from my bottom teeth under the plate, and nicked up my cheeks and gums as a result. One night at dinner, my mom got frustrated by the fact that I wouldn't speak. I'd only nod or shake my head, or barely open my mouth to let an easy word or two slip out. She asked to look into my mouth and found that they never removed the screws that the rods were attached to. The screws had buried themselves into my cheeks, and every time I'd eat or speak, the screws would pull and slip off of my cheeks. The ortho saw me the next days and removed them. I still have 4 scars in my mouth. Ortho told me that they'd almost gotten through my cheeks. Well, that's horrifying. Not a doctor, but I had close calls. For a few years, I often found myself falling asleep at certain time, often after work. However, with family advice, I went to the doctors and explained the symptoms. I was checked by a specialized in autoimmune diseases, as that ran in the family. I was given an X-ray and blood work. They noticed my thyroid wasn't working, Given the second of 2 cancer scares, I was eventually diagnosed with Hashimoto's thyroiditis and psoriasis. Thanks to unusual on my skin, I was put on hormones and steroids, likely for life. Howdy Miss Sarah. I was diagnosed with Hashimoto's and thyroid cancer about 6 years ago. The fatigue was crazy. TBH, I still have energy issues. They removed my thyroid and I now take replacement hormones. I also had another cancer scare about a decade earlier. Benign liver tumor from taking the pill. Look after yourself. I was the patient, but I walked into an urgent care clinic after I had pushed my teeth through my bottom lip. I was covered in blood and had a large hole in my face. I told the nurse who did the intake I was having trouble drinking water and was worried about dehydration and did not acknowledge the new face hole. She got real freaked out. I know someone who did this after crashing his bike. A big blood clot fell out of his mouth onto the reception counter at the after he asked how much he was bleeding. Happens to the best of us. I'm a patient. Growing up I assumed I was struggling in school because I was just a stupid miserable fuck up. I had zero confidence in myself or anyone else. Sometimes I would go days without sleeping, other times I would sleep all day. I thought about my own death constantly. I truly believed that I was a flawed person and that it would always be that way. Turns out I actually have bipolar disorder. And thanks to medications and therapy, I am a normal functioning human now. Mostly. Anyway, lol. Same, but with an attentive addict. I was fat. I thought my belly button, about 10 centimeters in diameter, was huge because I was fat. No one knows how long I actually had the hernia for. When it was first diagnosed, the docs tried to push it back in and it wouldn't go. I was told that due to my chronic severe brittle asthma and prescribed steroid use that I wouldn't be given surgery to fix it unless it was strangulated. 7 years later, surgery was planned for a year after another surgery. It strangulated during an exam I was videoed for. I finished the exam, and I had emergency surgery a couple of days later. My lecturer was marking the exam and noted that I went very pale and started sweating halfway through the exam. I passed the exam, although I am sure I could have gotten a medical certificate if I hadn't. I'm a patient who thought it was normal to have a headache nearly 24/7. It was actually the occasional absence of a headache that I initially believed to be problematic. Customary not a doc therapist part, but I don't know if I'll ever forget the moment I was told by my psychiatrist that I, 12 at the time, was experiencing emotional abuse from my mother. It was an immediate not my mother, surely because at 12, you totally know what abuse is. I, 13 years later, can definitely say that I was raised in an emotionally and physically abusive household. That's sad. I hope things get better. Until I was 19, I didn't know it was unusual for my feet to hurt every moment of every day. A lot. I have incredibly flat feet. They literally suction to the floor and make farting noises. I assumed that, like people told me, I was just incredibly lazy. Turns out, most people didn't grow up in constant pain. Thanks, Ehlers-Danlos syndrome. When I was 14, my therapist at the time had to explain to me that not everyone had periods of pure anxiety. I didn't understand her at all, although my mental illnesses were just normal and that everyone had them. I've been on meds for MDD, GAD and PTSD for 6 years now. Still bewildered that people wake up and don't have a constant flutter in their abdomen. I got tonsillitis a few years back. I suffered through it for about a week, but my wife convinced me to go to the doctors for antibiotics. Got there and the doctor found it weird that I had to look up to talk. I had to because that was the only way to create enough room in my throat to talk. She looks at my tonsils and says, yeah, we're going to have to keep you in hospital. If your tonsils swell anymore, you're going to stop breathing. I apparently have weirdly large tonsils and the swelling from tonsillitis was almost enough to close my thought. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.